Hello everyone, my name is Dr. Anas Hassan. I'm from Iraq. I'm the highest volume implanter in Iraq. And I'm pleased today to have my big brother, my friend, Professor Dr. Ege Serefoglu from Turkey. And he's one of the biggest experts in Turkey and also internationally. So, Professor, can you introduce yourself?
Thank you, Anas, for your flattering compliments. Hello, everyone. I am Professor Ege Can Serefoglu. I am a urologist in Istanbul, and I am also working as the editor-in-chief of International Journal of Impotence and Research. This weekend, we welcomed biggest experts from all over the world in Istanbul for a penile prosthesis masterclass, and we shared our experiences with each other. That's how we learn from each other, and that's how we master our skills. So we are very happy to have Anas here in Istanbul with us.
Thank you. I think you have listened to our lecture about penile implant in Iraq. So I want to ask about your opinion about things that have been gone in Iraq for the last 5 years. What do you think?
Iraq is our brother country. We have a lot of connections, a shared history. And even before Turkey exists, Iraq, Baghdad was the center of civilizations. And due to some sad events in the last decades, Iraq was completely disappeared from the map, and we were not hearing much about the technical developments, medical advancements there. So today I was very much shocked and pleased to hear the things that you are doing in Iraq, especially with the number of penile prosthesis surgeries, the technological things, the new techniques that you are doing there is amazing. It really made us proud of you and proud of our colleagues, friends, brothers and sisters in Iraq. So I would like to congratulate you for the progress that you are achieving there. And I'm really looking forward to see even more success coming from you.
Thank you. This is because of his dua and also because of his continuous support and continuous enthusiasm and inspiration. He's a role model for me.
Come on.
So I follow his steps, and now we are here sitting together in Istanbul. So I want to ask you about some questions about patients. So in Iraq, patients are skeptical to accept inflatable penile implant. What's the situation in Turkey?
It's more or less the same. As I've said, we are sharing a common history, so we are sharing same tradition, same culture, same religion. And we think that erectile dysfunction is a part of natural aging. After a certain age, asking for erectile function is a sin. It's not welcomed. It's against our tradition. No, that's not true. Erectile dysfunction is a disease, like a heart disease, like a leg disease, like a back pain disease, things like that. So it's part of aging in the majority of the cases. So if we are not happy with our sexual performance, with our erectile dysfunction, we need to see a urologist who is dedicated himself to this field, actually. And currently, the gold standard treatment of medical refractory erectile dysfunction is penile prosthesis. And nowadays, starting from 2018, American Urological Association and European Association of Urology, they abandoned the stepwise approach. So if a man is willing to keep their erections after 50, 60, even before trying pills, injections, and other vacuum erection devices, they can select penile prosthesis surgery immediately. As Professor Wilson, who was the main host of today, always says, every man will need a penile prosthesis. So they can wait for 15 years without having any sex, without having any pleasureful life, or they can immediately have a penile prosthesis and enjoy their life in a better way.
True.
So penile prosthesis is also not considered by the majority of our patients, But fortunately, things are changing. Nowadays, people have access to social media, to internet, to Google, to ChatGPT, and they are able to search for those treatment options. And in all those forums, in all those social media platforms, many patients are sharing their positive experiences with penile prosthesis. So I hope that here in this country, in Turkey, and in countries like Iraq, we will reach to the level of Americans and Europeans who are using this treatment more liberally than us.
Yeah, yeah. So when we mentioned that patients are getting information from Google, YouTube, and newly ChatGPTs, this is the new era of artificial intelligence. So maybe sometimes you will deal with a patient with unrealistic expectations. What are your strategies of dealing with such patients?
The patients are coming to our clinics and they are paying a certain amount of money for penile prosthesis, and they have the feeling, they have the assumption that everything will be like they are 18. They will be young again and they will be sexually active and things will be like a miracle. No, it's not a miracle. After all, this is a prosthesis device, and it's not gonna be as you are 18. So those unrealistic expectations are associated with patient dissatisfaction. What we are supposed to do is to inform our patients as much as possible. This is a medical device, this is a good treatment, and it's going to improve their sexual lives. This will not make their penis longer. They may be associated with complications. It's not a miracle, as I've said. So the patients should be informed as much as possible, and they should have realistic expectations about this treatment, and afterwards they will be happy with this surgical approach.
True. Because you have so much connections with the Western society, with USA, Canada, Europe, do you think there is a substitute, a radical treatment instead of penile prosthesis maybe in the next 10 years?
No. Penile prosthesis came to the market in 1973, so more than 50 years ago. And in those 50 years, there has been many technological advancements, many improvements in those devices, and they became like a very developed product nowadays. And I believe at the moment we reached to the peak level of penile prosthesis. There are some projects such as battery operated pumps, remote controls, and etc., but they are still under development.
And penile prosthesis. It's the same treatment but with improvements.
Correct, correct. So currently, if a man is having an erectile dysfunction, if he is willing to continue his sexual performance, the best treatment that he can get is penile prosthesis. And actually, a study recently published by our Belgian colleague, Koenraad van Rentergem, demonstrates that the patients who are having penile prosthesis are regretful that they didn't have this device 5 years earlier. So there is no need to wait too much. Our patients who are listening to us can consult to a good doctor, and there is no need to delay this treatment, which will improve significantly their lives and their partners' lives as well.
Mm-hmm. So again, I'm honored to sit with my biggest brother, Dr. Professor Ege Can Serefoglu, and we would love to have you in Baghdad someday.
Allah Rasi, Allah Rasi. It's going to be my honor and pleasure. I've been to Baghdad actually 2 times, and I had great memories.
We would love to scrub together.
Inshallah, inshallah.
Thank you.
Thank you.